Have you ever wondered about the different types of hepatitis? Today, we're discussing this important, yet often misunderstood, health topic. Hepatitis, a term that may sound quite familiar, actually refers to the inflammation of the liver. This condition is not caused by one but various viruses. Yes, you heard it right. There are 5 main types of hepatitis: hepatitis A, B, C, D, and E. Each of these types is caused by a different virus, and they each have their own unique characteristics and treatment approaches. While they all cause inflammation of the liver, the routes of transmission, severity, and geographic prevalence vary greatly. Understanding these differences is crucial not only for healthcare professionals, but also for the general public, as it can help in prevention and early detection. Now, let's delve into each type of hepatitis. First on our list is hepatitis A, a type of hepatitis transmitted primarily through the fecal-oral route. This means the virus spreads when an uninfected person ingests food or water that's been contaminated with the feces of an infected person. And yes, it's as unpleasant as it sounds. Now, let's dive into the signs and symptoms of hepatitis A. The tricky part is that not everyone who gets infected with the hepatitis A virus shows symptoms, but when they do, they can range from mild to severe. Common signs include fatigue, a feeling of being unwell, nausea, and abdominal pain, often near the liver on the right side beneath the lower ribs. One of the most telltale signs of hepatitis A is jaundice, which is a yellowing of the skin and eyes. This occurs because the liver isn't able to process bilirubin, a byproduct of red blood cells. What about treatment? Well, there's no specific antiviral therapy for hepatitis A. Treatment is primarily supportive and focuses on maintaining comfort and adequate nutritional balance, including replacement of fluids that are lost from vomiting and diarrhea. Rest is also important, as the body needs energy to heal itself. But don't fret, there's a silver lining. We have a highly effective vaccine that can prevent hepatitis A. It's usually given in 2 doses, 6 months apart, and provides long-term protection. Remember, prevention is key when it comes to hepatitis A. The virus can survive outside the body for months, so it's crucial to wash your hands with soap and warm water after using the bathroom, changing a diaper, or before preparing food. Avoid consuming contaminated water or food, especially in areas with poor sanitation. And of course, consider getting vaccinated, particularly if you're traveling to areas where hepatitis A is common. So that's the rundown on hepatitis A. It's a contagious liver infection, but with good hand hygiene, safe food and water practices, and vaccination, it's preventable. Moving on to hepatitis B, this type is transmitted through blood, sexual contact, or perinatal transmission. The culprit behind this infection is the hepatitis B virus, or HBV for short. Just like hepatitis A, the symptoms of hepatitis B can vary from person to person. Some may not experience any symptoms at all, while others might go through a range of discomforts. Common symptoms include fatigue and abdominal pain, similar to hepatitis A. However, hepatitis B also brings along a couple of additional signs such as jaundice, which turns the skin and eyes a yellowish hue, and dark urine. But don't let the silent nature of this disease fool you. Even without symptoms, the virus can still cause severe damage to the liver, leading to complications such as chronic liver disease or even liver cancer. When it comes to treatment, options are available to help manage the disease and prevent further liver damage. Antiviral medications such as tenofovir and entecavir can be used to keep the virus under control. Interferon therapy, which uses a type of protein to help the body fight off the virus, can also be employed. However, the best way to combat hepatitis B is through prevention. Vaccination against this virus is available and highly recommended. It's typically given in a series of 3 to 4 shots over a 6-month period. But what happens after the diagnosis? This is where nursing education comes into play. Patients should be educated about safe sex practices to prevent the spread of the virus. It's also important to avoid sharing needles or personal items such as toothbrushes or razors, as these can also transmit the virus. Remember, hepatitis B can be silent but deadly. However, with the right knowledge and preventive measures, it can be managed effectively. Educating patients on safe sex practices, avoiding sharing needles or personal items, and vaccination are crucial in preventing hepatitis B. Finally, we'll briefly cover hepatitis C, D, and E. Hepatitis C, like B, is primarily transmitted through blood. This virus is a crafty one, often remaining asymptomatic for many years while it quietly damages the liver. This is why hepatitis C is often referred to as the silent epidemic. When symptoms do appear, they can include fatigue, jaundice, abdominal pain, and loss of appetite. The treatment of choice for hepatitis C has evolved rapidly, and today, it primarily involves a class of drugs known as direct-acting antivirals. These medications have transformed hepatitis C from a chronic, incurable infection to a curable one in most cases. Now let's touch on hepatitis D. This is a unique type of hepatitis because it only occurs in people who are already infected with hepatitis B. It's known as a satellite infection and can make the symptoms of hepatitis B more severe. Lastly, we have hepatitis E. This one is similar to hepatitis A in terms of transmission and prevention. It's often spread through contaminated water or food, particularly in regions with poor sanitation. Like hepatitis A, most people recover fully from hepatitis E without treatment, but it can be severe in some populations, such as pregnant women. In conclusion, hepatitis C, D, and E, like all forms of hepatitis, pose significant health risks. Hepatitis C, in particular, is a leading cause of liver disease worldwide. Hepatitis D complicates hepatitis B infections, and hepatitis E can be particularly dangerous for pregnant women. While we've only touched on hepatitis C, D, and E today, remember to take all types of hepatitis seriously. Prevention and early treatment are key, so stay informed and take proactive steps to protect your liver health. As we wrap up our discussion on hepatitis, let's quickly recap what we've learned today. We've explored the 5 types of hepatitis, A, B, C, D, and E. Each has its own unique characteristics and modes of transmission, but all cause inflammation of the liver. We delved into the signs and symptoms, which can range from fatigue and nausea to abdominal pain and jaundice. However, it's important to remember that not everyone infected will experience symptoms. Treatment options vary, from supportive care for hepatitis A to antiviral medications and interferon therapy for hepatitis B, and direct-acting antiviral medications for hepatitis C. Prevention is key, with emphasis on hand washing, avoiding contaminated food and water, safe sex practices, and vaccination where available. Nursing education is also crucial, focusing on these preventative measures and ensuring patients understand their importance. Remember, knowledge is power when it comes to your health. Make sure to share this information with others and help spread awareness about hepatitis.